All right, the question is, after having a diagnosis of a basal cell carcinoma and being told to come back in 6 months, is that something to be worried about? So if it was called a basal cell carcinoma, then it was a cancer. So I think sometimes that the information that people get can be confusing, and the word benign and cancerous can be confusing. The names of the lesions can be confusing. But if it was a basal cell carcinoma, it is a cancer. So the message that you must have been given was that it was completely removed, and they wanted to check back in 6 months. That's standard of care. It's certainly your choice whether you go back or not. The good thing about basal cell carcinomas is that you can see them coming back. So that's what the dermatologist wants to do. They want to look at the scarred area where the lesion was removed and see if there's any clinical evidence that the skin cancer is growing back again. Within the first year of the removal, there's the highest chance that it can come back. But skin cancers can recur at the site where they developed and were treated 5 and even 6, 7 years later. So that's why we recommend that long. Those are usually a little bit bigger to begin with, but it can happen. But the main thing that is important at the follow-up visits is looking at the rest of the skin, because once you have one skin cancer diagnosed, you're at high risk of developing another one because you've had enough sun exposure and you have the skin type that allows those to develop.